Okay, and just give me a minute to start. So at the beginning, I'd like to say good afternoon to everyone. I'm delighted to welcome you back to our Human Technology series after our summer break. I believe that these conversations where we explore the intersections of people, technology, and law return today with a truly important topic and a remarkable guest. It's great pleasure to introduce Dr. Sabire Yilmaz. I don't know if I pronounced it correctly. A legal expert in artificial intelligence, data protection, and digital law. She's a PhD researcher at the Santa Anna School of Advanced Studies in Pisa, a member of the scientific committee of the Data Intermediaries Alliance, and has over 16 years of professional legal experience. Today, she will guide us through key questions around the Europe Health Data Space, data altruism organizations, and the role of trust, both, I believe, in AI systems and in the institutions that regulate and oversee them. So, Sabire, I'm very grateful that you accepted my invitation. I'm very glad that you're here with us, and now the floor is yours.
Thank you very much. Your brief introduction. So thank you also invite me. Yes, very great a day talking about technology and human. Very hot topic nowadays. So I add some things because my PhD in health science and technology. So everyone knows my background is law. So I'm sharing my ideas. It's about the only European health data space today. So we shared three different kind of subjects, but maybe another lesson. We deep dive Trustworthy AI and trust systems for healthcare system and for in European health data space. So thanks to each one attending in this meeting. So I want to share my screen with you. So I hope this works correctly.
Yeah, it's fine.
And okay, we jump to each slide now. Can you screen my second and third and
Yeah, we can see
yeah, page? Okay, everything is okay. Great. Okay, let's start. We are talking about European Health Data Space regulation. This regulation is a very new regulation. We know very well in March 2025 was adopted in all Europe. So all membership is a member of Europe is take responsibilities for compliance and implement all issue in European health data space. It sets out common rules, standards, infrastructure, and governance framework with a view to facilitating access to electronic health records, their use in patients' primary data to secondary use of data. We can say European health data space is a first data space, but related to much more different kind of spaces. It is not one space, but we talk about a single space, but the space is sharing atmosphere with much more data spaces and with same standards compliance. The aim is to arrive to high quality data that is crucial. The system does not work, or the aim does not implementing without high quality data. It is very important issue. Support and strengthening patient to sharing trust data for cross-border infrastructure and improve scientific research in all medical fields, all healthcare sector is also important workflow in European health data space. The health data space enhance the General Data Protection Regulation, GDPR, data subjects' rights in the context of electronic health data, and at times goes beyond that. It accounts for other data-related questions, such as the role and scope of an individual's autonomy regarding diverse processing aspects and primary use, the control of data in regard to secondary use, and the balance between self-determination and public interest in the primary and secondary use of data. So here some before and after European health data space schedule. So before European health data space, ex ante stage is very different after European health data space. So for example, data access stage is before European health data space, health data mostly fragmented, hard to access to national level and between to national level if we talk about cross-border data. After European health data space, EU-wide standards, implementing standards enable cross-border access. So all EU membership countries and member of countries create a different kind of standards, but under the single standard system. So each countries must be implementing to all EU standards, all EU health data space standards. Before European health data space, we see about the patient rights. Access to electronic health data varies by country, often limited. So every electronic health record system is national and has a local standard. So the other member states is strongly implementing GDPR standards for access to electronic health record system. But after European health data space, patients can easily access and control their health data in a cross-border area, so all EU countries. Secondary use aspect is before health data space, researchers face difficulties using data across countries. So for scientific research, for public good, etc. But after European health data space, common European health data space infrastructure enables secure sharing for research and innovation. Before European health data space, data governance is different, has a different national laws, fragmented, divided, different kind of divided system, but after ensure transparent, interoperable governance. So we talk about much more semantics and syntactic interoperable system between each country's EU member country. So standards and technology, different file formats, incompatible system has. But after a European health data space, common technical standards and interoperable electronic health record systems. So we see much more. We talk about the electronic health records exchange format. So the format is we talk more the next slides. So electronic health records exchange format can easily readable, machine readable standards creates between each EU countries. Citizen trust mechanism before European health data space, high skepticism about data sharing because each data subjects worries about the data sharing cross-border because they don't know anything to without for example implementing the GDPR or without the know some GDPR rights. But after electronic health record system, some standards and some strongly implementing GDPR coming from increased trust and security, more trust and more security, transparency, and data altruism mechanism. So each data subject altruistically shared their data for scientific research, for public good, for good health. So electronic health, European health data space defines some patients' rights, but the patient's rights is not completely different from the GDPR data subjects' rights, but maybe little bit differences from the GDPR patient's rights, the GDPR data subject rights, because the patient has right to access. So the access must be free and interoperable, has interoperable standards, and data subjects, patients, can share their data with any, for example, across membership countries, provider in the EU, and right to control who, for example, right to control their rights and who can access your data and who can, for example, share data and which aims share data to cross borders. So finally, if we say shortly, the patients control their data altruistically and their data freely access and portable all EU countries, we can say. Let's we look healthcare provider duties. The duties is very large, has very large scale because the healthcare providers duties is so crucial, so important. Developing electronic health record system and developing European health data space infrastructure. So it is so important. It is noted that this could prove a challenge for healthcare resourcing in some member states, especially residual 89. stresses that improving digital literacy, both for patients and healthcare providers, will be fundamental to the success of the regulation and the European health data space. This requires the member states should allow for their health professionals to take digital literacy courses, which will enable these professionals to be better prepared to ensure cybersecurity and ethical management of health data. Some member states provide support to public and private healthcare providers to set up personal electronic health data spaces to enable interoperability standards between different healthcare providers. Access to electronic health records by healthcare providers or other individuals should be transparent to the natural persons concerned. Electronic health data access services should provide detailed information on access to data, such as when and which entity or natural person access to data and which data were accessed. So it is so important. Natural persons should also be enable or disable automatic notifications regarding access to personal electronic health data relating to them through health professional access services if a natural person has exercised the right to opt out. We know very well the opt out as a right, define a right in European health data space. So healthcare providers will still document the treatment provided in accordance with applicable rules and will be able to access the data registered by them. Natural person who exercise the right to opt out should be able to reverse their decision. In such cases, personal electronic health data generated during the period of the opt-out might not be available via the access services and My Health platform, My Health EU platform. So electronic health data made available in an interoperable format and which can be transmitted between healthcare providers can also reduce the administrative burden on health professionals of manually entering and copying health data between electronic systems. When accessing data relating to their patients, health professionals should comply with the applicable law, code of conducts, deontological guidelines, or other provisions governing ethical conduct with respect to sharing or accessing information, particularly in life-threatening or extreme situation. In accordance with regulation, GDPR, in order to limit their access to what is relevant in a specific episode of care, healthcare providers should follow the data minimization principle when accessing personal electronic health data, limiting the data access to data that are strictly necessarily and justified for a given service. Providing health professional access service is a task assigned in the public interest. By this regulation and the performance of such task requires the processing of personal data as referred in Article 6, point A of Regulation GDPR. The regulation provides for conditions and safeguards for the processing of electronic health data by the health professionals access services in accordance article with 9 and point H of Regulation GDPR. For instance, detailed provision regarding logging of access to personal electronic health data and that aim to provide transparency towards data subjects. However, these regulations should be without prejudice to national law concerning the processing of health data for the delivery of health care, including national law establishing categories of health professionals that can process different categories of electronic health data. While electronic health record systems are widespread, the level of digitalization of health data varies in member states depending on data categories and on the coverage of healthcare providers that register health data in electronic formats. In order to support the application of data subjects' rights of access to an exchange of electronic health data, union action is needed to avoid further fragmentation. In order to contribute, categorize some, for example, electronic health record exchange format should form the basis for specification related to the registration and exchange of electronic health data. So here, some of health providers and some stakeholders' responsibilities schedules in European health data space. So we are finding much more stakeholders, for example, patients, healthcare providers, technology providers, and researching innovators and public authorities and data access bodies. The stakeholders related each other some technical under some technical standards, so we can define some standards more. For example, which standards implementing to their rights or which standards strengthening healthcare more. So we can decide it or we can find new standards or new technical infrastructure from the European health data space, but we can we must read very focused. So some researcher finding more privacy enhanced using some privacy enhanced technologies, so defined to electronic health record system is more federated if we using some federated structure defining some, for example, stakeholder responsibilities and implementing to European health data space. So maybe we define more federated structure, each other's stakeholders relationship. So each other stakeholders has different kind of responsibilities. For example, patients control access to their data and data restricted consent, participate in data altruism organization for sharing altruistically data for scientific research. And on the other hand, technology providers must build secure scale and must build interoperable solution and maintain European health data space compliance, so support usability and accessibility, more different kind of each different kind of standard in each different kind of spaces. So every stakeholders has very different kind of responsibilities. And on the other hand, we see My Health EU platform. This is a platform for reading cross-border data exchange. So how does it work, this system? So we can define more. The system is using some data catalogs. So the data catalogs is exchange to some data from the from the state to state. So this is during to data in a cross-border area. So the data using some exchange standards for interoperable and create some interoperable structure. The European Health Recourse Exchange format is a standardized, machine-readable format that allows for the secure and interoperable exchange of electronic health data across EU member states, as mandated by the European Health Data Space Regulation. It ensures that health data can be shared simply between different systems, providers, and countries, supporting function like cross-border healthcare and patient access to their own records and the use of data for secondary purposes. This transformation is based on three main goals outlined by the European Commission: European Health Data Exchange format, interoperable components work with the different kind of electronic healthcare exchange program. So, secure data access and sharing, connecting and sharing health data for research and quicker diagnosis and improved healthcare. On the other hand, empowering citizens and improving individual care through digital services. A data exchange format is a standardized way of structuring and encoding information so that it can be shared and understood between systems, software, or organization. It ensures that data can move smoothly without losing meaning or accuracy. It is so highlighted because data must be saved meaningful. So between cross-border countries. A data exchange format is like a common language that enables different systems to share information seamlessly. Using standardized formats such as XML ensures that data remains accurate and interoperable across platforms. In healthcare, data exchange formats are crucial for interoperability, allowing patients' records to be securely shared across hospitals and research networks. So, empower patients, citizens can access and share their data, their own data, health securely, data securely. So we can see the other platform, Health Data EU platform. So we saw My Health EU platform, the My Health EU platform for primary use data, but Health Data EU platform for secondary use of data. So we have two different kind of platform, but the both of platform has an interoperable system. The secondary use of health data enables secure access for research and policy making across Europe. So we can say real world data has a pivotal role for the secondary use of data. So primary use stage is very important that the completed perfectly and transmission to secondary use of cases. So secure research and policy making access and it is very important. And the other issue, health data access bodies, data permits process is very important for the secondary use of data. And health data access bodies are responsible for issuing permits, ensuring that only authorized users can work with the data. So each health data access body is authorized data permit stage for the secondary use of data. To protect individuals, the data provided is always pseudonymized or anonymized. So each state defines in this case, but the more defines, we can carefully using pseudonymized data to cross for the cross-border stage for the secondary use of data. So transparency in this stage, transparency is a key principle. Data set use and outcomes achieved must be published for accountability. So this approach builds trust while unlocking to value of health data for society. And here we are data altruism organization between linked to European health data space. So you know very well, data altruism organization defines before Data Governance Acts. But the data altruistic organization is very important to implementing aim for the electronic health record system. So if we using data secondarily or reuse for the scientific research, data altruism organization is more helpful for the secondary use of data stage. So data altruism organization introduced by the Data Governance Act allow individuals to voluntarily share their data for the common good. The European health data space builds on this principle, creating a trusted framework for the secondary use of data, health data, and together, both of parts encourage citizens to contribute data in a safe and transparent way, enabling research, innovation, and better health policies. This close relationship ensures that altruistically shared data can flow securely into health research and public policy across the EU. So another issue after the secondary use of stage, so all sharing data process must compliance GDPR and it is security. So cyber security is also a very big issue. The whole system of secondary use of health data is designed to remain fully compatible, so compliance with the general data protection regulation. This ensures that principles such as lawfulness, fairness, data minimization, and accountability apply to every use of health data. The European Commission acts as a data processor, meaning it handles data only according to strict instructions and does not decide independently how data is used. Member states act as joint controllers, sharing responsibility for ensuring that data processing compliance with EU rules and protecting individuals' rights. So, other hand, the cybersecurity is especially randomized controlled trials cases which have data used for the scientific works. The health data implies to real-world data for creating real-world evidence. For sure, real-world evidence in the cybersecurity case especially, some data is not completed, unstructured, and missing data. So it is very increased high risk for the cybersecurity research. So here we are goes to single framework and multiple system. So we can define European health data space more single framework, but the other hand, multiple systems. So this diagram illustrated a federated personal health space architecture, a patient-centered approach to health data management. Patient-centric design, the citizen sits at the center, maintaining control over their personal health data. Federated architecture, data remains distributed across multiple sources rather than centralized. Hospital systems, example, prescription systems, laboratory results, insurance company resources, hospital keep hospital data, or your smartwatch keeps fitness data. So all of ours is interest in multiple resources. So you can control who can access your data, what data from which sources. So more secure, no single point of failure, and easier to comply with privacy laws in this structure. So we suggest more this structure has to be federated personal health data space. So more for more compliance to secondary use of system, for more compliance to privacy laws. And here we go, timeline. The timeline is very important. So we are on the way and still on the way. So the European Commission, we say before we adopt delegated acts, define the technical and legal details. These acts will specify standards, interoperable rules, and procedures for data sharing. So by March 2029, they compliance primary and secondary use of data. The first wave of health data use becomes mandatory. Primary use and secondary use rules, health data can also be reused for research, innovation, and policy making process. in 2029. By March 2031, new data categorizes defines. So the European health data space expands to include more complex health data types, such as medical images, laboratory results, discharge summarized from hospitals, and this broadens the scope of data available for both primary and secondary use. And by March, finally, by March 2034, inclusion of third countries. The system will open to cooperation with third countries outside the EU. So this may enable data sharing and collaboration with trusted international partners under strict conditions. The European health data space will not be built a single step. It has a clear roadmap. In 2029, by now, it enters into force, followed by technical rules in 2027. And by 2029, the first use cases like patient summaries and prescriptions will active alongside the secondary use of data. In the 2031, new categorizes such as medical images and laboratory results and will be included. Finally, by 2034, the system will extend to third countries, creating a truly international framework for health data. So here we are. Conclusion. The success of the European health data space will depend not only on technical implementation, but on building and maintaining public trust. Through its emphasis on transparency, patient rights, digital literacy, and ethical data management, the regulation creates the foundation for a healthcare system that is both innovative and trustworthy. As we move toward full implementation, the European health data space represents more than a regulatory framework. It embodies a vision of healthcare where data serves humanity, privacy is protected, and innovation flourish within a framework of trust and accountability. This is Europe's commitment to leading the world in responsible, effective, and patient-centered digital health transformation. So the big framework, and we can maybe start by now reading more data quality and data utility label for public good and for scientific research implementing in the European health data space. Yes, maybe we can jump question or comments.
Yeah, so does anybody have a question or want to share his or her thoughts? I've got two questions, but I'll give the floor to our participants first.
Okay.
I can't see, so I start with my two questions because lately I was on a conference on AI in health, and I heard two very important issues from one of the doctors who said the first thing was that we don't have time that regulations need in R&D. So what should we do to change the situation? And to change the regulations so that the R&D could be made much faster than now. And the second issue was that he said that we should switch our thinking from the way that the data, the medical data are our own, and that those data should belong to the society. So he said that he, as a doctor, thinks of our medical data not as something that belongs to us, but something that we owe to the society. So to improve the R&D move. So what do you think about that? And how can we deal with so many different regulation? Because we've got the regulation you said about, we've got GDPR, we've got AI Act, and many more regulations. And how can we find how can we improve the movement, the inventions, etc., if inventors are in this regulation field in Europe especially?
Yeah. Very good question. Thank you very much for your bold of question. And I try to start to first question. And the medical data, yes, to link to has to link to society for secondary use of purposes, but we have to start to real data. So we have to start to micro data. The micro data linked more to patients. So real world data. So real data. So a person's data. The person's data is sensitive data. Is more sensitive data. So we talk about the different kind of data that we use to, for example, primary use or secondary use care, and for primary use for real world treatments. So the person treatments in a prescription system, in medicine and medical, so healthcare. So the data, real world data stored, but another issue, we have to use to secondary use of data for society. So the board of system is needs to not much more regulation, but needs to much more trust. So we create more trust system. So the much more regulation not answered, okay, our questions more, because if we use to some data, all data is going to go, to be sensitive. So the sensitive data, yes, implement to link to some GDPR rules, but European Health Data Space needs to implementation to GDPR at the same time. So why we regulate to different kind of, okay, regulation, and we say European Health Data Space, because we have very strong regulation for the EU GDPR, and GDPR so regulates to some data subject rights. But why we need to European Health Data Space? Because European Health Data Space linked much more stakeholders, so much more linked to innovative part, much more economy, much more financial parts, so we say. And so we regulate to trust mechanism, because we need to much more trust for to data sharing and organizing or managing data sharing economy and data sharing for example, if we say to medicine or healthcare. So healthcare still needs to data, but still we need much more homogeneous data. So we need much more structure, homogeneous and interoperable data. Okay, different kind of system, because must compliance to data sharing economy, and must compliance to some standards, must compliance to some technical environment, so technical software, for example, components. So we can read very correctly, and we try to understand very correctly how regulation mention, or how regulation regulates what different kind of, for example, different kind of mechanism or different kind of system. European had data space regulation, and how, for example, create a new relationship or organizing or managing relationship or relationship to between kind of, for example, different kind of regulation, GDPR, EU, AI Act, and medical devices regulation, and etc. So it is very uh, I can say it's very hard question, okay? So we don't know this kind of relationship. Yes, must be interoperable, but how? So still we try to find, okay, a good answer, because this main reason, I have to say, this main reason, legal terms, legal vocabulary, legal databases is very different than a technical or technology databases, technology vocabulary, technology, how it says, okay? So both of system is work very different kind of spaces. So maybe, let's say, European had data spaces create a interoperable infrastructure for both of different kind of vocabularies, okay? Because the vocabularies must be works together for public good, for scientific research, for everything. And European data strategy is regulates and says much more to different kind of system linked to each other, okay, and has a good relationship, because following to some steps and between each other, okay, some, for example, some articles with some articles with some regulating some things. So finally, I have to say, I have to talk. We need we need to medicine. We need to still we need to innovative drugs. Still we need to technology, a good technology for protection, personal data, for protection, person for protection fundamental rights and some freedoms. Still, we need a technology, but all fundamental rights, all data subject rights, all health data is not a technology. Still is a fundamental right, still is a freedom. So the technology has to be protected, okay? Has to be protected, but still we try to answer, okay, how technology is protect to more data protection rights or more, for example, data sharing trust mechanism. How technology is well protected, okay, to all system. This answer is not answered yet.
Okay.
Or implies yet, because you know, you and me still talking about technology, talking about legal tech and many more places. So we define, for example, privacy preserving technologies. So we show that some technology aspects, for example, sensitive data technology, homomorphic protection, and anonymized data or pseudonymized data is the best one to protect to all, for example, data protection, right? But who knows, okay? Who knows? Never the technical experts say to the best technology is anonymization data or pseudonymization data. So this technology is never re-identified or they identified to personal data protection. Still, we couldn't say, okay? So this is very big problem. But we say this aim is very crucial aim in European health data space. So different kind of vocabulary maybe find a way, okay, to working together for public good, for scientific research, etc.
Thank you very much. Does anybody else have any questions or comments? If not, thank you very much, Sabire, for being with us. This meeting has been recorded, so in some time we put it in internet, and everybody would be able to see. If anybody has questions, you can find Sabire in LinkedIn. She's very good at sharing her thoughts, and she really does a great job in that field. So I believe you should find her and
It is
say
my
to
pleasure.
her. Thank you very much. Thank you for being with
Thank you
us,
very much.
and I hope we shall meet soon.
Thank you to you all participants. Okay, next to see you very soon
Thank you
and
very much.
all over the world. Okay.
Thank you.